Welcome to our presentation on anxiety disorders, understanding and treating the challenges. Anxiety, a natural response to stress, can become overwhelming and irrational, profoundly affecting an individual's daily life. Throughout this guide, we will delve into the diverse array of anxiety disorders, their symptoms, and the effective treatments aimed at empowering individuals to regain control and find relief. Let's explore the complexities of anxiety disorders together. In understanding anxiety disorders, it's essential to grasp the physiology behind anxiety itself. The body's stress response, overseen by the amygdala, serves as a vital survival mechanism. This response is coordinated by the hypothalamic pituitary adrenal (HPA) axis, which releases hormones and chemical signals crucial for maintaining balance within the body. However, when this stress response becomes excessive and irrational, it manifests as an anxiety disorder. Excessive worry and fear can significantly disrupt an individual's social and occupational functioning, impacting various aspects of their daily life. Moreover, anxiety disorders often coincide with other mental health conditions, such as major depressive disorder, MDD. Symptoms like fatigue, sleep disturbances, and difficulties concentrating are frequently shared between these disorders, further complicating the clinical picture. Generalized anxiety disorder, GAD, is characterized by persistent and excessive worry about various aspects of life, such as health, finances, safety, and relationships. This worry must be disproportionate to the actual threat and persist for at least 6 months, significantly affecting the individual's daily functioning. Individuals with GAD often experience physical symptoms like agitation, irritability, sleep disturbances, difficulty concentrating, muscle tension, and fatigue. These symptoms can exacerbate their distress and contribute to the overall impairment in functioning. Treatment for GAD typically involves a multifaceted approach, including relaxation techniques, cognitive behavioral therapy, CBT, and medication. Selective serotonin reuptake inhibitors, SSRIs, are often used as first-line pharmacological agents, while buspirone or benzodiazepines may also be considered in some cases. To receive a diagnosis of GAD, the excessive worry and associated symptoms must significantly impact the individual's social and occupational functioning compared to their baseline level of functioning. This emphasizes the importance of assessing the severity of symptoms and their impact on daily life when considering a diagnosis and treatment plan for GAD. Panic disorder is marked by the sudden onset of intense physical and psychological symptoms, including palpitations, rapid heart rate, chest pain, shortness of breath, feelings of detachment from oneself, and profuse sweating. These panic attacks can occur unexpectedly and without an identifiable trigger, leading to significant distress and impairment in daily functioning. This disorder is more prevalent in women, particularly those aged between 20 and 35. Risk factors may include a history of abuse or trauma, as well as a family history of panic disorder. Treatment for panic disorder typically involves a multifaceted approach. This includes relaxation techniques and cognitive behavioral therapy, CBT, which can help individuals manage symptoms and cope with panic attacks. Pharmacological interventions such as selective serotonin reuptake inhibitors, SSRIs, tricyclic antidepressants, TCAs, benzodiazepines, and beta blockers may also be prescribed to alleviate symptoms and prevent future episodes. In addition to these interventions, avoiding triggers such as caffeine can be beneficial in managing panic disorder. By addressing both the psychological and physiological aspects of the disorder, individuals can work towards effectively managing their symptoms and improving their overall quality of life. Phobias encompass a spectrum of anxiety disorders characterized by excessive and irrational fears of specific objects, situations, or social interactions. Specific phobias involve an intense fear of particular triggers, such as animals, heights, or needles, which can significantly disrupt daily life. These fears may arise from learned experiences or classical conditioning. Social phobia, also known as social anxiety disorder, is marked by an overwhelming fear of social situations or public scrutiny. Individuals with this disorder may experience extreme discomfort or anxiety in social settings, leading to avoidance behaviors to alleviate distress. Agoraphobia is another type of phobia characterized by an intense fear of situations or places where escape may be difficult or embarrassing. This can include crowded areas, public transportation, or open spaces, leading individuals to avoid these environments altogether. Treatment for phobias often involves cognitive behavioral therapy, CBT techniques, such as exposure therapy, where individuals gradually confront their fears in a controlled manner to reduce anxiety responses. Medications such as benzodiazepines or beta blockers may also be prescribed to manage symptoms during exposure therapy and alleviate acute anxiety. By addressing the underlying fears and teaching coping strategies, individuals with phobias can learn to manage their symptoms and regain control over their lives, ultimately improving their overall well-being and quality of life. Obsessive compulsive disorder, OCD, is a debilitating condition characterized by persistent, intrusive, and irrational thoughts, known as obsessions, which evoke significant distress and anxiety in affected individuals. These obsessions often revolve around themes like contamination, symmetry, or harm, and can be highly distressing. In an attempt to alleviate the anxiety provoked by their obsessions, individuals with OCD engage in repetitive behaviors or mental acts known as compulsions. These compulsions are often ritualistic in nature and can include actions like excessive hand-washing, counting, or checking. However, these rituals only provide temporary relief and can consume a significant amount of time and energy. It's important to distinguish OCD from obsessive compulsive personality disorder, OCPD, where individuals exhibit rigid and perfectionistic traits but lack the distress and impairment associated with OCD. Unlike OCPD, individuals with OCD often recognize the irrationality of their thoughts and behaviors, although they feel unable to control them. Treatment for OCD typically involves a combination of cognitive behavioral therapy, CBT, specifically exposure and response prevention, ERP, which helps individuals confront their fears and resist engaging in compulsive behaviors. Additionally, selective serotonin reuptake inhibitors, SSRIs, are often prescribed to help alleviate symptoms. In some cases, the tricyclic antidepressant clomipramine may be used as an alternative or adjunctive treatment option. By addressing the underlying obsessions and compulsions through comprehensive therapy and medication management, individuals with OCD can experience significant improvement in their symptoms and overall quality of life. Adjustment disorder is a common yet often overlooked condition characterized by difficulty coping with significant life changes or stressors. These stressors can range from relationship issues and financial problems to the loss of a loved one or changes in one's living or work situation. While the symptoms of adjustment disorder may resemble those of major depressive disorder, MDD, the condition is generally less severe and tends to improve once the individual adapts to the new circumstances. Unlike MDD, adjustment disorder does not always necessitate formal psychotherapy or counseling. However, therapy can play a valuable role in helping individuals develop effective coping strategies and navigate the challenges associated with their current situation. By providing support and guidance, therapy can facilitate the adjustment process and promote resilience in the face of adversity. It's important to distinguish adjustment disorder from acute stress disorder, which involves a more intense and persistent reaction to a traumatic event. While both conditions may involve difficulty coping with stress, adjustment disorder typically arises in response to ongoing life changes rather than a single traumatic incident. Acute stress disorder, ASD, and post-traumatic stress disorder, PTSD, are both conditions that can arise in response to traumatic events, but they differ in their duration and severity. ASD typically develops in the immediate aftermath of a traumatic event and is characterized by symptoms such as dissociation, intrusive thoughts or memories, avoidance, hypervigilance, and mood disturbances. These symptoms must last for less than 1 month to meet the criteria for ASD. PTSD, on the other hand, is a more severe and enduring condition that can develop after an individual experiences or witnesses a traumatic event. The symptoms of PTSD, which include re-experiencing the trauma through intrusive memories or nightmares, avoiding reminders of the event, negative alterations in mood and cognition, and heightened arousal, must persist for more than a month to be diagnosed as PTSD. The treatment of PTSD typically involves a combination of psychotherapeutic interventions and medication. Evidence-based therapies such as cognitive behavioral therapy, CBT, eye movement desensitization and reprocessing, EMDR, and interpersonal psychotherapy, IPT, can help individuals process and cope with their traumatic experiences. Selective serotonin reuptake inhibitors, SSRIs, may also be prescribed to alleviate symptoms of anxiety and depression associated with PTSD. Benzodiazepines are a class of medications commonly used as anxiolytic agents in the treatment of anxiety disorders. Examples include alprazolam, lorazepam, diazepam, and clonazepam. These drugs work by enhancing the inhibitory effects of the neurotransmitter gamma-aminobutyric acid, GABA, resulting in a calming effect on the central nervous system. While benzodiazepines can effectively alleviate symptoms of anxiety, they are not without risks. Common side effects include sedation, confusion, ataxia, slurred speech, and respiratory depression, particularly when taken at higher doses or in combination with other medications. Additionally, long-term use of benzodiazepines can lead to tolerance, dependence, and withdrawal symptoms upon discontinuation. In cases of benzodiazepine overdose or toxicity, flumazenil may be administered as an antidote. However, it is essential to exercise caution when using flumazenil, as it can precipitate seizures in individuals who are taking certain benzodiazepines, such as lorazepam and diazepam. Therefore, its use should be carefully considered and monitored by healthcare professionals. Buspirone stands out as a unique anxiolytic medication, distinct from benzodiazepines in its mechanism of action and pharmacological profile. Unlike benzodiazepines, which act on the GABA system, buspirone modulates serotonin, 5-HT1A receptors in the brain, contributing to its anxiolytic effects. One of the significant advantages of buspirone is its lower risk of physical dependence and withdrawal symptoms compared to benzodiazepines. This characteristic makes buspirone a preferred option for long-term management of anxiety disorders, especially in patients prone to substance abuse or dependence. In terms of side effects, buspirone is generally well tolerated, with sedation being the most common adverse effect. Importantly, it does not induce the same level of cognitive impairment or respiratory depression observed with benzodiazepines, enhancing its safety profile for a broader range of patients. Selective serotonin reuptake inhibitors, SSRIs, represent a cornerstone in the pharmacological management of various anxiety disorders, including generalized anxiety disorder, GAD, panic disorder, and obsessive-compulsive disorder, OCD. Medications like fluoxetine, sertraline, and paroxetine belong to this class, offering a reliable first-line treatment option. The mechanism of action of SSRIs involves inhibiting the reuptake of serotonin, a neurotransmitter crucial for regulating mood, anxiety, and other cognitive and physiological functions. By enhancing serotonin levels in the brain, SSRIs help alleviate the symptoms associated with anxiety disorders. One of the key advantages of SSRIs is their favorable side effect profile compared to older antidepressant classes like tricyclic antidepressants. SSRIs are generally well tolerated, making them suitable for long-term use in managing anxiety disorders. In some cases, SSRIs may be used in combination with other pharmacological agents, such as benzodiazepines or beta blockers, to provide additional symptom relief, particularly during the acute phase of anxiety disorders. This combination approach can offer comprehensive treatment and better outcomes for individuals with severe or treatment-resistant symptoms. Tricyclic antidepressants, TCAs, like clomipramine, play a vital role in treating obsessive-compulsive disorder, OCD, by inhibiting the reuptake of both serotonin and norepinephrine. This dual mechanism of action contributes to their efficacy in managing the symptoms of OCD. However, TCAs are associated with a range of side effects, including sedation, anticholinergic effects like dry mouth and constipation, as well as cardiovascular effects. These side effects may limit their use in certain patient populations or require careful monitoring during treatment. Despite the potential side effects, clomipramine as a TCA has demonstrated particular effectiveness in treating OCD, for individuals who do not respond adequately to SSRIs or other first-line treatments. The TCA agent offers a valuable alternative, helping to alleviate symptoms and improve overall quality of life. Eye movement, desensitization and reprocessing, EMDR, is a specialized form of psychotherapy that has shown effectiveness in treating post-traumatic stress disorder, PTSD. This therapeutic approach involves utilizing rapid eye movements or other bilateral stimulation techniques to assist individuals in processing and integrating traumatic memories. The underlying mechanism of EMDR is thought to involve the facilitation of the brain's natural information processing system. By engaging in bilateral stimulation during therapy sessions, individuals can reprocess traumatic memories in a more adaptive manner, thereby reducing the emotional distress associated with them. Research has demonstrated the efficacy of EMDR in reducing the symptoms of PTSD, including intrusive thoughts, avoidance behaviors, and hyperarousal. Through EMDR, individuals can work towards regaining a sense of control and well-being, ultimately leading to improved overall functioning and quality of life.